You are listening to the Keeping It Juicy podcast.
Your main squeeze in nutrition.
Don't forget to subscribe so you can join us every Tuesday for a brand new episode.
Also, don't forget to add us on Instagram and Facebook at Keeping It Juicy Podcast.
All right, everybody, welcome back to our show. Today is episode 88, which is a very exciting topic, especially now in the heat of COVID. We're going to be talking about telehealth and the future of it and a little bit of the past of it too. But before we get into that, let's dive into our new nutrition in the news.
So our new nutrition in the news is, I just thought I'd bring this out because I was just talking to a client about this the other day. And it is, the name of the article is Confused by Whole Grains Labels on Food Packaging. Study finds that you're not alone. So apparently whole grains on cereals, breads, and crackers, if you guys don't know, have labels on them. And apparently they're very confusing to consumers and could cause them to make fewer, healthier choices, according to the results of the study that tested whether people are able to pick out healthier whole grain options based on food package labels. And when I was teaching this class a couple of days ago, we had a whole issue with food label debates. And anyways, we'll go into it. So basically, the study had a pool of 1,030 U.S. adults, representative of the population, who responded to a survey with photos of both hypothetical and real products. The photos show the products with various whole grain labels on the front of the product of the package, along with nutrition facts label and ingredients list for each product. Participants were asked to identify the healthier option for the hypothetical products or assess the whole grain content for the real products. So for the hypothetical products, 29 to 47% of respondents answered incorrectly. And then for the real products that were not mostly comprised of whole grains, 43 to 51% of respondents overstated the whole grain content. So basically those that weren't really whole grain, they actually thought were healthier. And consumers more accurately stated that the whole grain content for an oat cereal product that really was mostly composed of whole grain. So it's just very confusing results. The packages on the hypothetical products either had no front of package whole grain label or marked with multi-grain, made with whole grains, or whole grain stamp. The packages on the real products displayed the actual product markings, including multi-grain, honey wheat, and 12-grain. The study goal was to assess whether consumers misunderstood the labels. And labels are supposed to meet a legal standard for enhanced U.S. labeling requirements for whole grain products. So in case you guys don't know, products aren't just supposed to have labels willy-nilly. They're actually regulated by the U.S. government. And the legal standard relates to deceptive advertising and evidence that the labels are actually misleading or likely to mislead consumers can actually bolster support for these regulations. So previous research has shown disparities in whole grain intake in the United States, including, for example, lower intake for adolescents than for adults, and lower intake for participants in the Supplemental Nutrition Assistance Program, also known as SNAP, than for higher income non-participants. The authors of the new study found that consumers who were younger, had less education, were Black, or reported having difficulty understanding food labels were more likely to answer incorrectly in the test involving hypothetical products. So a large chunk of Americans' daily calories, about 42%, comes from low-calorie carbohydrate. So the biggest challenge that we're seeing right here is that we need to give more clear of a label to make healthier choices. So
I'm frustrated because I'm confused. The labeling is very confusing. We know that the whole natural is confusing. This whole grain is confusing as well. But why I'm so frustrated is because what's healthy for someone might not be the healthy option for someone else. And what I mean by that is let's just say they said that the participants were reflective of the entire population, right?
Mhm.
We know 1% of the population has celiac disease. I hope someone in this study had celiac disease. They're going to answer what's healthier and what's not very
Right,
differently than someone who is not, or
right,
someone that has like IBS or something and has problems with like a lot of fiber. Whole
right,
grains have a lot of fiber, and that might not be the healthier option for someone else. So
right,
that's this whole healthy term
right,
makes things confusing too. It's like pick the healthier one. That doesn't mean it's the healthier one for everybody. Like everyone's dietary needs
right. And
vary.
they in the US political like food guidelines is just that's what it is. It's a guideline, and it, we can get into that in another episode. But there's a lot of political factors that go into those guidelines on top of research.
Mm-hmm.
But the fact of the matter is, with this article, is labels are confusing. They're
Mm-hmm.
confusing. I've talked to many clients and many patients before that get confused. That's why
I
I've
still get
like
confused. Like,
right,
yeah.
right. And I look at a product, I'm like, okay, it says wheat blood, and I look at it, I'm like, this motherfucker is bleach and they add color to it. This is yeah, I don't. This is not wheat bread. This is not the like. I understand why it's hard to choose the healthier option, quote unquote,
Right.
but that's because we're also like I only know what goes into product because we're nutrition professionals. Anyone that's not in the nutrition field is going to be confused.
Yeah. Which is
Which
fine, is very, it
right,
takes a long time to be able to know like what kind of goes into a product. And I'd even like to argue too, like why do whole grains have to be better if you're getting enough fiber in your diet from other sources as well?
right,
Like there's no rule in the rule book that says
right,
you have to eat whole grains. Yes, the dietary guidelines suggest eating more whole grains, but that's because fiber is a nutrient of concern. So the reason the US dietary guidelines encourage whole grains is because fiber is a nutrient of concern. Whole grains have more fiber and more nutrients as well. A lot of our population is overweight yet
right.
nutrient deficient.
Mm-hmm.
That's an issue that is kind of new for the human race. Um,
Right. I
it's
don't,
just this complicated issue of like, why is that healthier than that?
right. I don't know. It was just
It's interesting because I'm confused too.
I I mean, it's gonna be a while before labeling is fixed overall. Even the term organic is an issue in itself, which will that sounds like a whole other episode that we need to talk
Done an
about. So,
episode on organic, but
but
I like to share this example a lot because I like food. So when I'm at the grocery store, I like to look at all the different products that are available. I'm reading labels to
right.
find time. But
Yes.
like the most exciting point in my week, honestly. So, anyways, I'm at the grocery store and I'm looking at like all of these different crackers, right? Just seeing what's out there. And there's this brand, it's called Organics. Like that's the name of the brand, and they make this cracker because I'm looking for some crackers. So I look at the crackers, not that I needed organic, but I like the
Right.
picture, I wanted to see it. I read the ingredients. It's nothing in it is organic. It's not certified organic on any level because there's different levels to it. The name of the company is just Organics, making you think that the product itself is organic, but it's not organic whatsoever. So this is again just a marketing scheme.
Right.
It had nothing to do with their food label or their claim. It's just what they decided to name their company. Um,
Right.
Not bashing it. It's probably a tasty product, but it's not organic.
Right.
So if you're eating organic for whatever reason, you just got tricked if you bought that product.
You just got. I just
So
like I was just talking to my clients like in that class. I was telling them I was like, do not think the food industry is on your side.
No,
ever.
no, they're not.
Ever.
Ever.
They're always gonna trick you. I even told them about how much money a shelf will cost on the grocery store. How if you go to the very top, that's probably the cheapest option, and the very bottom is the cheapest option. But if you do right at eye level, that's your most expensive shelf
Oh,
for the company's product to put their stuff in. So companies are after your money, and this is just another, like, there's a whole lot of issues that this study is bringing out, which is not pretty. But I don't know. Let us know what you guys think about this article. We'll attach in the show notes, but I'm not liking it.
I mean, it right, like you said, it's just bringing to light a lot of different issues, like
Hmm.
why are some things healthier than other things? When in reality, we should really just be making
Right.
sure we're getting all of the nutrients that we need and eating foods
Mhm.
that we enjoy. Like, honestly, I definitely used to think like, oh my gosh, I have to eat whole grain everything because that's what they kind of shove down your throat. I wonder how many lobbyists stood behind that a couple years ago and whole grain.
Right.
Now I totally prefer white bread. I prefer
Right.
white rice over brown rice. It just digests better for me. When I
Hmm.
eat brown rice, I don't feel good. I don't feel
Right.
good at all. And I've tested this. So why am I going to torture myself and
Right.
eat brown rice when it doesn't sit right with me?
Hmm.
Um, but if you like brown rice, like eat all the brown rice you want, but you just
Right.
have to eat what works for you. And
Right.
labels kind of misguide us, I think.
It's a fun time to be alive.
It is. It's definitely a fun time.
Oh, wow.
Another fun thing that's going on in the world today is telehealth.
Speaking of which,
So let's move on to the bulk of our episode, but please let us know what you think about this whole grain article. We'd love to have a conversation about it, clearly. But we're going to move on for now. Today, we're going to be talking all about telehealth. So, even in the 90s, we actually always heard about how the World Wide Web would be changing the future of communication. And I'd say it definitely has. When the internet was introduced, people were a little bit skeptical. I feel like it's difficult to actually pinpoint a particular event in time in the past 3 decades or so when the internet became such an integral part of the way we communicate with each other. I was born in the early 90s, and I can remember the internet kind of always being around. How we got on the internet was very different. I remember having to like pay per minute and
oh my God, put in
um,
that AOL CD, just
yep,
waiting.
exactly. And now you can hop on the internet anywhere. You can call anyone anywhere. You can FaceTime, Zoom, catch the news anywhere you want. But for me personally, I do, did grow up with the internet, I
Right.
suppose, just in a completely different sense. So I don't know what it was like before the internet. Um, but for telehealth, the adoption curve is a bit clearer. So in a little over 6 months, as we know, life has kind of turned sideways on us. Since the outbreak of COVID-19, many things have changed, including telehealth's position in healthcare delivery. People are working from home, and travel has been obviously restricted. Schools and public events have been halted. Among this, healthcare has seen a huge rise in telehealth. As of now, the public really desires healthcare options that are a safer and more convenient method of seeking care, and telehealth has been an obvious vehicle for this. So, whether healthcare organizations are ready for or not, the era of virtual care has arrived, with telehealth spearheading this change. Fucking crazy, right?
I'm just thinking of the Terminator, like literally everything.
But it's true, patients, clients, they really do want to experience telehealth more
Mhm.
now. I remember, a year or two ago, I could never get any of my clients to hop on a video call with me. They would not do it. Like, they refused. Like, all of them refused. And now it's all we do. So I'm like, huh, it's interesting, right?
Who knew a virus could do this? I mean,
I'm not complaining. I love to stay home. So
right, exactly.
I
But
love it.
right. And with that being said, the rise of telehealth, I mean, given how rapid the spread of the coronavirus has been, it's been impacting the traditional methods of healthcare delivery, as we were talking about. And telehealth is now being used much more widely to screen and diagnose patients without risking exposure to the virus. A 2019 survey actually conducted by the M3 Global Research demonstrated that the adoption of telehealth has increased more than threefold. And this was in 2019. And 22% of respondents conducted video sessions with patients, up from 5% in 2015. I don't know what the percentage is now.
Right.
Among those who used it, 93% agreed that telehealth improved patients' access to care. The requirement for social distancing measures is impacting the way hospitals and medical practices manage incoming patients. Even providers who previously did not offer any telehealth services are now gearing up to implement the technology in some form, a move that has actually been supported by the Centers for Medicare and Medicaid Services, so CMS. Like even one of the doctors at the dialysis care facility, he's like an old Asian dude. I'm not gonna say his name, but he likes to come and see his patients in person. And we finally agreed for him to do telehealth. And it's so funny because we just saw like the top half of his head while he was talking to a patient. I'm like, almost there, sir. Almost there.
It's a learning curve for
Right.
all of us. You learn something new every day, but he tried.
It was so funny, but I was like, I guess this is what it's coming to. Like literally us bringing in a screen to each patient. But sometimes that's what you gotta do.
Right. That's crazy. But now we're going to talk primarily about telehealth and nutrition counseling. So although the number of dietitians providing telehealth nutrition services will likely continue to rise with the advent of new communication technologies and broader regulatory policies, the Academy generally considers this to be an emerging area of practice for many healthcare professionals. What's actually interesting is many of you know I'm in my master's program right now. We had an entire course on telehealth. I'm getting my master's online, so it's pretty appropriate that we learn
Right.
about how to virtually communicate in a virtual master's program. But
Right.
honestly, prior to that class, like I had no idea how many implications like it actually had.
Right.
And it's ever changing. So the regulations, policies, and standards are in flux right now until a gold standard kind of becomes a consensus. COVID-19 is definitely expediting that process to get us to a gold standard. But with regards to telehealth, at a minimum, there remains the same liability and privacy concerns, but there are additional ones as well. So providers should be very clear about what HIPAA privacy rules apply when it comes to patient information, particularly when it comes to the use of technology and the fact that much existing and commonly used technology is actually not HIPAA compliant, and being aware of the additional restrictions that are imposed upon people providing that sort of care, and understanding when their states recognize that they are providing telehealth. So state to state regulations could be different. I'll also throw in here a big conversation that we had in my class was about Zoom. So Zoom is actually not HIPAA compliant when you're on the free version. A lot of providers do use Zoom, and there are paid versions that are HIPAA compliant,
Right.
but you need to know exactly which ones are and aren't. And of course, there's other
Right.
client management systems that are a little bit more healthcare related than Zoom. But even if you're just coaching a client or something, Zoom is actually not HIPAA compliant.
Right. It's not. And actually, I was just talking to a friend of mine who was on the free version, and they were just having a group discussion in one of their Zoom meetings, and someone popped on that they did not know. Like just popped on and like basically hacked into the group, and they're like, "Okay, we're shutting this meeting down."
What? How weird.
Right?
I mean,
So,
at least, like, I thought Zoom added that waiting room right now because of COVID.
I mean, I think it was a while ago, but it's still something to note.
Right. So at least Zoom did something to try to, because everyone's on Zoom right now. Like, we're on
Right,
Zoom right now. This is how we do our podcast.
right.
Um, but with patients, like, you can't use Zoom. Like,
No,
definitely not. Um,
definitely not the free version.
no, no. And Zoom is actually pretty affordable, even when you look at some of
Oh,
those
yeah,
more compliant levels. It might be $14 a month or something. So
it's fine.
just if you are a private practice, pay for it, be safe, protect your clients.
Hmm.
That's it. Skype is definitely not HIPAA compliant whatsoever.
That's
The
what
Skype
Skype,
one.
Skype dropped the ball.
Skype
During
dropped.
this
You
whole,
had years to prepare. You had years to
you
prepare.
were in the forefront. What happened, man?
Zoom was like,
Oh, man. I don't even want to imagine
what
Skype stuff.
happened to Skype?
I should have invested in Zoom. Anyways,
But what happened to Skype? Like, why did no one, like,
I don't know. I don't understand what's happening over there. Like
they dropped the ball?
Zoom is like they're not doing anything. All right.
Here we are. So funny. Let's move on. So, similar to the Academy's assertion that the same liability and privacy concerns exist for both in person and telehealth provision of care, the American Medical Association Code of Medical Ethics, opinion 1.212 states, although physicians' fundamental ethical responsibilities do not change, the continuum of possible patient-physician interactions in telehealth, telemedicine give rise to differing levels of accountability for physicians. So the Code of Ethics for the Nutrition and Dietetics profession, which was updated in June 2019 and developed by the Academy and its credentialing agency, the Commission on Dietetic Registration, also emphasizes the importance of safeguarding patient-client confidentiality according to current regulations and laws, and implementing appropriate measures to protect personal health information and using appropriate techniques, for example, encryption, making sure no one pops onto your Zoom meeting when they shouldn't be there. It is important to note that safeguarding patient privacy in virtual nutrition care extends beyond adhering to HIPAA and other related policies and includes establishing a confidential setting to conduct the remote counseling session. In the digital era, healthcare providers have a range of communication platforms that foster multitasking and on-demand connectivity. However, conducting a counseling session while walking down the street or in the elevator or on your way home in a public coffee house is not acceptable whatsoever. That's not an acceptable environment for ensuring patient confidentiality.
I would hope not. I don't want to hear about someone's issue with their liver on their way to
So
work.
one of my biggest issues with, like, I'm sure you guys know it, but like the different, like, hey, work from home, work anywhere type businesses, and people are like at the pool and they're just like helping clients from beside my pool. It's like, that,
No,
no, like, you should not be talking to a client about their personal information at your apartment complex pool when anyone could, that's
next time I see an Instagram post with
like,
someone saying that, I'm like, HIPAA!
yeah, HIPAA compliant.
HIPAA!
And they probably don't even know what HIPAA means. Beside the point. Um,
Still funny.
but it's like they glamorize this, like, oh, work from anywhere. Like, I talk to clients when I'm at the grocery store. It's like, but no,
You should not be. You should not be.
you absolutely should not be doing that.
Look at us. You should not be.
So just a side note there. those health
Yeah.
coaches are definitely not HIPAA compliant. So
Mhm.
unless you want everyone knowing your business, don't go to them. Okay?
Yeah, definitely not. So, anyways, the Center for Connected Health Policy, so that's available through the Academy's telehealth webpage, provides an actual list of a comprehensive list, actually, of all the state regulations. So, you might want to pay attention to that related to the provision of virtual healthcare, including policies that protect patient privacy. Earlier within the year, the Academy updated its web-based licensure map with additional information to facilitate practice across state lines, either in person or through the provision of telehealth services. So, according to this March 26, 2019 issue of the Academy's Public Policy Weekly News, the map now specifically lists state by state provisions by which RDNs might be made more easily eligible to practice in another state, even if that state requires a license to practice, including licensure by endorsement through the CDR. So, according to the March 26, 2019 issue of the Academy's Public Policy Weekly News, the map now specifies state by state provisions by which RDNs might be made more easily eligible to practice in another state, even if that state requires a license to practice, including licensure by endorsement through the CDR, licensure by reciprocation based on licensure in another state, and other exceptions such as allowances for temporary practice under limited circumstances. So, in addition to recognizing state specific licensing requirements for providing ethically sound remote care to clients and patients, there are additional best practices that address potential liability concerns and safeguard of patient privacy. So in 2019, the US Centers for Medicare and Medicaid Services, which also happens to be the nation's single largest healthcare payer, which, if you're not in a healthcare facility, CMS is a huge determinator of a lot of things. And they've actually expanded its reimbursement for remote care services as it did in 2018. So in 2020, like they did so many changes. That's why I know even when I worked in dialysis, like once CMS agreed, just for the safety of everybody, like we were rolling out like patient signatures to make sure we can get telehealth going like almost immediately. So there's been a lot of change going on, and actually the new rule announced by CMS allowed for physician reimbursement for virtual check-ins, remote image evaluation, and other remote technology services. So, although this is a notable move toward wider adoption of virtual care services, audience have an opportunity to engage in grassroots advocacy to propel the nutrition and dietetics profession within the realm of telehealth, which I feel like we're starting to do that anyways right now. So, any research that is produced showing that increased access to care and improved patient outcomes can be linked to telehealth intervention can be a part of advocacy efforts for the profession of dietetics. As dietitians in some states continue to seek licensure bills, which is a big issue, this type of information can be used as further evidence for the need to streamline and simplify the state-to-state licensure setup currently in use so that dietitians can easily be involved in providing that telenutrition care for the patient's benefits. So I feel like we're moving a lot towards that direction anyways. I mean, I'm sure I didn't tell you guys yet. I'll be moving to Arizona by the end of the year. Whoop, whoop. So I'll be joining the other host at her location. But I know I'm still going to be able to help out my private practice that I'm helping out right now if I keep my Texas licensure. So
That's the key part.
I'm still going to keep my Texas licensure. And I'm totally fine. I have another friend of mine who's not a dietitian, but she's a social worker, but she has two licensures. She has a Texas and a Kansas licensure in case she wants to practice in both.
And I do feel that that is fairly common to
Mm-hmm.
hold multiple licensures. One of the main things that we discussed in my course on telehealth was specifically for those who want to open up a private practice and do a completely virtual type experience for their clients. And that
Right.
has been skyrocketing for a
Mm-hmm.
while, even prior to COVID. Um,
Right.
through dietitians, not just your hokey pokey health coaches, but actually through dietitians opening up their own private practice,
Right.
um, but wanting to counsel, coach, help people across the United States. How
Right.
many licensures do they need to have to practice in each state? It gets really confusing. And then
Mhm.
are you going to bill through insurance? Depending on what your private practice is.
I don't
Things
know.
to
I
consider.
mean, I think it really depends on the type of service that you
Right.
provide, honestly. I know,
Mhm.
like, I'm only keeping my licensure and I have an MPI number because a lot of my patients go through a bariatric program through a physician's office and whatnot. But in regards to other patients, like, if it's cash pay, that doesn't matter so much.
Right.
So,
Exactly. Yeah. Totally different ball game when we're talking
right.
cash pay. But when you get insurance involved, that's when things get a little bit fuzzy.
Insurance never solves anything. Anyways.
It's like, what's more confusing, insurance or whole grains? Like, I don't know.
Some say they're both the same level.
We gotta make a meme. What's the difference between these two photos? Insurance and a whole grain. They're the same photo.
Dietitian problems, nutrition problems,
Yeah.
guys.
Seriously. So now let's talk about some of the challenges that we didn't expect when it comes to telehealth. So until recently, the key challenges in the widespread adoption of telehealth were geographic limitations and the originating site of care. CMS had restricted Medicare reimbursement to telehealth services that met one of the following three criteria. So one is a site located in designated rural health professional shortage area. And two, the program is part of a federal telemedicine project. And three, the patient receiving the treatment was located in an approved facility, such as a provider's office or a hospital. Um, with COVID, some of that can be a problem being
Yeah,
in physical. It completely contradicts the whole point of telehealth in the first place.
right.
Um, Additionally, reimbursement of these services has been a significant challenge. As of 2019, 41 states and DC had laws governing reimbursement to telehealth visits in a fully insured private plans, but the laws enacted by states vary. Payment parity, meaning that the telehealth services covered by private plans had to be reimbursed at the same rate as in-person services, had long been considered a drawback to nationwide telehealth adoption. So the sweeping regulatory changes by CMS declare that providers can bill for telehealth visits at the same rate as in-person visits, which is something to look forward to. Third, and arguably the most important change in the provider-patient relationship in virtual visits. So according to a report on Americans' perceptions of telehealth during COVID-19, 23% of respondents feel uncomfortable speaking with an unfamiliar healthcare provider, which presents an opportunity for physicians who choose to adopt telehealth technology to further engage existing patients. For those telehealth providers that primarily handle one-time urgent issues, it's critical that telehealth providers take the time to plan out their patient's care journey and understand their situation to engage with them in a meaningful way.
So, what should we expect, like, considering everything going on? So, hospitals and healthcare systems with a patient centered approach to care need an effective strategy to communicate with their patients. They have actually begun to leverage healthcare data platforms that can support secure and real time virtual visits to reach more patients, triage them quickly, and to improve care coordination. Additionally, virtual visits have the potential of saving up valuable and scarce resources during the pandemic. Ramping up telehealth adoption in a planned manner can make a significant contribution to screening, testing, and treatment efforts against coronavirus in general. Even for patients that have medical conditions unrelated to COVID-19, virtual care makes it possible to deliver care remotely without bringing the risk of virus exposure on either side into the equation. These are, without a doubt, hugely challenging times for us. Telehealth is far from being perfect in the current world, and many adjustments are just temporary, and there's going to be more adjustments, but coronavirus will end one day, and just like the internet, telehealth will remain predominant in U.S. healthcare. At least that's a feeling. And another thing I wanted to point out that we did not address earlier, yes, telehealth is the future, but my biggest concern is not everyone has the means to get internet right
Right.
away.
Mhm.
So that would be my biggest issue or biggest disparity that I would see with this telehealth.
Right.
If that makes sense.
Absolutely. Because, we do live in a virtual world, but not everyone has a cell phone. Not everyone has a computer, and not everyone has access to the internet. Um,
Hmm.
and we used to say like, oh, you can go to a coffee shop and get their free internet. It's like, well, not if you're going to be discussing your health.
Right.
You're not going to want to talk about some potentially very private
Right.
concerns in the middle of a coffee shop, and not that you can even do that now anyways because of COVID. So
Right. And some places don't even have coffee shops.
right.
But
Yeah, exactly. So
it's
there's
just
still some concerns.
so it's still that's another challenge I wanted to point out because
Oh,
yes, it's
absolutely.
growing, but there's also that issue in mind.
Right.
That's why I don't know. And it's like it's already become an issue. I've noticed that. I mean, I'm just gonna take for example, like um my boyfriend, he like this is a whole other issue on its own. He has been having his back issues for the longest time, and he was trying to get a doctor's visit, but they canceled on him twice because he's a new patient, so only existing patients can go, which is fine and dandy. But like his is a mild case, but it's been worsening. So I'm just wondering what's happening to other patients that are new that are trying to get the
Things figured
like
out. Yeah.
right.
Yeah.
So that's another challenge that I've come across, at least from the local doctors' offices here. Like, granted, I understand that you can't take new clients, but there's always going to be patients out there, and it's hard to treat patients if you turn them away. So that's just something else. Um,
Right.
like how we're supposed to get preventative health when we keep
When you're
refusing.
trying and you keep getting canceled on.
Right. So that's just another challenge I wanted to throw out too. So I don't know if any of you guys have experienced any of this, like any of the challenges that we've talked about, or what your thoughts or concerns on telehealth is. Like, I think it's great from like me as a provider, but me as a potential patient or of one of these offices that I need to go to, I can also see issues from that aspect as well. So.
At the office I'm at, the providers have mentioned that they feel there's been way more cancellations
Mm.
since transitioning to telehealth. They're not sure if people are forgetting their appointments, even though they get appointment reminders, or if they feel like it's, you know, less accountability. I don't know. I'm not 100% sure.
There might be other factors involved because actually at the private practice that I'm at, I've actually had more people show up
Wait,
because of telehealth. Yeah, because
health visits then.
right, telehealth visits or just over the phone visits because let's say a patient doesn't show up and I call them like, hey, where you at? They're like, oh, I totally forgot. I'm like, that's okay. Let's do it right now. And we're
Right.
encouraged to do that. And they're like, oh, okay. I'm like, this is still a good time. They're like, yes. I'm like, great.
Right.
Let's talk
Right.
about your health and how are you doing.
Right.
So, but that's also me. I'm an aggressive person.
Right. Big Aries energy.
Anyways, let us know what you guys think about this whole episode.
Mhm.
But before we close it out, I'm just gonna go ahead and do our social media shout out, and that goes to at Pearl Pastries, and basically she considers herself to be a kosher registered dietitian who is translating nutrition into practical cooking tips.
I
She's
like that.
yeah. She's
Yeah.
based out of New York City, and she has so many posts of delicious cooking, and she like kind of talks about the nutrition behind it. So definitely go check her out. I really like her page, and
Mhm.
we definitely appreciate you supporting us.
I like the whole idea of kind of like bridging the gap between, okay, my body needs these nutrients. How do I actually do that? Like, now
Right.
what?
Help.
Because it sounds easy, but it's actually really hard sometimes.
Right.
Um, I get in funks too. So yeah,
Right.
great page. Thank you for the support. We appreciate it.
Mm-hmm. So with that being said, I'm gonna close out the episode. If you want to be our next social media shout out, like our shit, send our shit, do all the shit.
All the
And yeah, and we'll pay attention, I swear.
We pay attention all the time, but we'll pay more attention.
God, that sounds bad. Anyways, so we will see you guys next time. But before we close it out, don't touch anybody. Don't let anybody touch you because COVID is still happening and we don't want it to happen to you. Did I just rhyme? Oh, no, actually, just
I don't think you rhymed.
this is awkward. Anyways,
Bye,
we're gonna
guys. We will catch you next week. Thanks for listening to the Keeping It Juicy podcast.
your main squeeze in nutrition.
Don't forget to subscribe so you can join us every Tuesday for a brand new episode.
Also, you can find us on Instagram and Facebook at Keeping It Juicy Podcast.
We'd love to hear from you, so please leave us a review
5 stars, no less.
on whatever platform you're listening to, or send us an email at keepingitjuicypodcast@gmail.com.
Or if you have any topics you'd like for us to touch upon, shoot us an email. Until next time, don't do anything that I wouldn't do. So there are whole grain labels on cereal, bread, and crackers, in case you guys didn't know, and apparently they're very confusing to consumers and could cause them to make fewer healthier choices, according to results of a study that tested whether people are able to pick out the healthier. One fucking moment. I love you, but I'm recording and I could hear you through the fucking door. So if you can private for the next 30 minutes, so if you can for the next 30 minutes, that'd be awesome. I would love you. Thanks, Greg. Got mad I called him out and I'm like,
That was